Hi everyone, my name is Lindsay, and this semester I chose to study Pompe disease, also known as glycogen storage disease type 2. So, what is Pompe disease? Pompe disease is a genetic neuromuscular condition caused by a mutation to the GAA gene, and the GAA gene encodes for an enzyme known as acid alpha glucosidase. Acid alpha glucosidase plays an important role in the body as a lysosomal enzyme. It breaks down glycogen, which is a complex carbohydrate, into glucose, a simple sugar. This is a super important process because glucose is the main energy source for most cells in the body. Patients with Pompe disease cannot break down glycogen, and over time, toxic levels of glycogen build up in their muscles and other body tissues. Additionally, patients with Pompe disease either don't make any or very little of the GAA enzyme, or the GAA enzyme that they produce does not function correctly. Pompe disease greatly affects the muscles and impairs them from functioning normally, and we will see this with many of the common signs and symptoms of the disease coming up. So, how exactly is the gene affected? So, by studying patients with Pompe disease, we have learned that there are over 200 different mutations to the GAA gene that can cause Pompe disease. However, the C3213TG splice mutation is the most common. This is an intronic mutation, and this causes exclusion of exon 2 from a variable portion of the expressed GAA mRNA. So, something interesting about Pompe disease is that this mutation does not always prevent transcription of the normal enzymatic activity, and researchers think that this could possibly be why some patients don't express the condition until later on. And we will see that coming up in the next couple slides here. So there are two types of Pompe disease. The most common and dangerous is infantile onset Pompe disease. The symptoms typically appear a few months after birth. And symptoms between patients can vary, but these are some of the most common. So, hearing loss and speech issues, and typically these speech issues are caused because patients have an enlarged tongue. The tongue is a muscle, and so that excess glycogen causes it to enlarge and inhibit speech. Respiratory difficulties are also common. This can lead to total loss of ability to breathe independently or dependency on oxygen. Infants also experience an increased risk for contracting upper respiratory infections, which is super dangerous in infant populations. We also see enlarged hearts and livers due to the excess buildup of glycogen, and this reduces the function of both of those organs. Feeding difficulties can cause failure to thrive, poor weight gain, and last, muscle weakness and floppy limbs, which often lead to gross motor delays. And I included a picture to the right here. You can see an infant with Pompe disease, and they just really don't have muscle tone in those muscles due to that excess glycogen buildup, and they are just really have those floppy limbs, are unable to hold up their head or their arms and legs. So that's just one example of what an infant with Pompe might look like. The second type of Pompe disease is late onset Pompe disease. This is less common and typically less deadly, but the symptoms can still be really severe and cause death if not treated properly. So the symptoms of late onset Pompe disease can arise at many different times. Some patients experience it later in childhood, others in adolescence, and some people even into adulthood. Some of the symptoms overlap. Patients often have a severe cough and shortness of breath, maybe have the inability to breathe independently or be dependent on oxygen as well. We see sleep apnea, the skeletal muscle weakness as well, same with infant onset. And if not treated or diagnosed properly, many patients will be bound to a wheelchair. Cognitive impairments and increased risk of a stroke are due to the effects of that toxic level of glycogen in the brain. Hearing loss and speech abnormalities, similar to infantile onset, we see that enlarged tongue. And then it greatly affects the digestive system due to the smooth muscle found in the digestive system, and can also cause loss of bladder control and urinary incontinence. So let's quickly talk about the prevalence of Pompe disease. So globally, depending on where you live, the prevalence ranges from about 1 in every 20,000 to 40,000 live births. Here in the United States, those numbers are closer to 1 in every 40,000. And the prevalence of Pompe also varies based on ethnicity. So individuals of African American or Southern Chinese descent are more likely to be afflicted with the condition. So the mode of inheritance for Pompe disease, it's inherited in an autosomal recessive pattern, which means that both copies of the GAA gene allele have to have the mutation in order, one from each parent, in order for the offspring to express it. So to the right here, I've just included some Punnett squares showing how this might play out. The first one shows one parent who is afflicted with the condition and one parent who is a carrier. In this situation, 50% of their offspring have the potential to be carriers, and 50% will be afflicted with the condition. Next, we have another Punnett square showing two parents who are both carriers for the condition. In this situation, there's a 25% chance that the child will be afflicted with Pompe disease and a 50% chance that they will be carriers. Finally, we see one parent here who is homozygous dominant and does not express Pompe disease, and one parent who is a carrier. In this case, there's a 0% chance that the child will have Pompe disease, but a 50% chance that the child will be a carrier. So let's take a look at a pedigree. This pedigree demonstrates autosomal recessive inheritance pattern. So many of the other conditions we learned about this course would have a similar look in a pedigree for this kind of inheritance pattern, but we can just take a look at a few here. So Chase and Lauren at the top, they are both carriers of Pompe disease, and due to this, there's a 25% chance that one of their offspring may express the condition. So in this case, Hudson is homozygous recessive. He expresses Pompe disease, and Hudson marries Jenna, who is a heterozygous carrier. Due to this, there's a 50% chance that their child may have Pompe disease, and in this case, Hannah has the disease. Another way that this could be passed through the generations is Tatum is the offspring of Chase and Lauren. They are a carrier due to their parents, and Tatum marries Alex, who is also a carrier of the condition. There's a 25% chance their offspring will have the condition, and in this case, Annabelle does, one of their 4 children. So this is just an example of some of the ways that this genetic condition can be transferred through generations and show up on a pedigree. There's multiple options for genetic testing. If parents are concerned that their child may be afflicted with Pompe disease, they can test them in utero. There's 2 different options. The first is amniocentesis. In this situation, as you can see in the picture below, a sample of amniotic fluid is taken while the baby is in utero, and that will be genetically tested. And the second is chorionic villus testing, and in this situation, they take a small biopsy of the placenta, and then that is genetically tested for Pompe disease. In the case that the infant was positive for Pompe disease, they would, the parents would be able to make some decisions, and they would have a better treatment plan set up for the child once they were born, if they knew that they were afflicted with the condition. Another option for genetic testing, all infants will be tested for Pompe disease on the state newborn screening, granted that their parent doesn't opt them out. If this test comes back abnormal or out of range, a confirmatory test will be done to confirm the child has the condition, and in this case, treatment would be started. In the case of late onset Pompe disease, as I mentioned before, the symptoms of late onset Pompe disease and Pompe disease have a lot of similarities to other neuromuscular conditions. And so in this situation, a provider would typically order these genetic tests to rule out other conditions and to confirm Pompe disease. And these genetic tests are completed by either testing for absence of the GAA enzyme or the presence of 2 of the common GAA mutations. Currently, Pompe disease is not curable, although there's research that suggests that it could be in the future, but luckily effective treatment is available. The current treatment regimen for patients with Pompe disease is enzyme replacement therapy, or ERT. This functions to replace the GAA enzyme so patients' bodies can begin to break down glycogen normally. To the right here, we see just a diagram of how effective ERT can be. On the right panel, we see once patients start this therapy, their body functions start to, or their body starts to function normally again. They're breaking down glycogen, and then all the way at the bottom there, we see we have improved muscle function, and a lot of the detrimental effects of the disease can be reversed once therapy is started. And then finally, it's just important that to understand that early detection of the disease is imperative. Without treatment, especially in infantile onset Pompe disease, infants die before their first birthday. So effective diagnosis and treatment is imperative for the health of patients. Last but not least, here is my references slide. Thank you so much for listening.